Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned community ophthalmologist, Dr. Uday Patil. Though he worked as a specialist, he was in charge for 17 years at the mobile eye clinic. And because of that, he has served more than 11,000 people and helped them. And today he is here to tell us what is the national program to remove the blindness, and also the importance and why the today's doctors as well as the community should join hands in removing the blindness in our country. So welcome, sir.
Good morning, madam. Good morning.
Sir, good morning. Sir, many times, we see that there is a concentration of doctors only in the cities and the other part of the country are neglected. And in this direction, what is the central government or the state government and others are doing? And what is this national program, community ophthalmology? Please tell us, sir.
Thank you, madam. As you said, every citizen should have a good eyesight. Sarvendriyanam Nayanam Pradhanam. So this is the concept of our government of India. But as you said, we are seeing a lot of qualified eye specialists in urban areas.
Yes,
and if
sir.
you leave the city and go to little interior, Taluka hospital, Taluka side or village side, yet we don't have qualified eye surgeons. So, as you know, 70% of our population are still in rural areas.
Yes.
So, to cover those people who cannot come to cities because of so many other reasons, socio-economic factors, it is our duty, government duty we should go to their doorstep, identify their eye problems, and make them good citizens of India. Let them see this world at whatever age, younger age group, a boy or child should go to school. Should not deprive of our education.
I think because of this only there is a saying: if the Muhammad cannot go to mountain has to come to Muhammad. So the whole equipment and the mobile clinic and all the specialists, they go to the doorsteps of the villagers and the taluka places. And that is, I think that is the most important thing. Please go ahead, sir.
The national program started by Government of India. I think it is in 1976. Kartar Singh Committee proposed. So many national programs have come up. And this is one of the national programs. This is the national program for control of blindness. Control. So blindness, you see, control. Nowadays,
not eradication.
We cannot eradicate because population is increasing alarmingly.
Yes.
So our idea is to control. We have got some people who are having visually disabled in children, in middle age, and old age. All three parameters we consider. And for children, we go to school health program, identify their problems. And in 1,000 population, there are 6 to 8 people who are visually disabled. They need attention. Yes. Especially children, school children, lot of squint is there, vitamin deficiency there, refractive errors are there, injuries are there, corneal opacity they have. All these factors should go to schools, identify, and government is giving some aid to the schools, and we give some spectacles, free spectacles for the BPL card holders, and spectacles for the other children also at low prices, so that they should not be deprived of our vision and they should attend the school. Under Sarva Shikshana Abhiyana, we go to Anganwadi centers, identify the children who are malnutrition and vitamin deficiency, corneal ulcer, keratomalacia, they are very common.
They can have the night blindness and so many things. Yes.
Children. And for that, government gives vitamin A liquid also for the children. We get solution, 1 dakkan or 2 dakkan, 50,000 units we administer for 11 doses till the child becomes 5.5 years. So that we should not be having vitamin A deficiency, night blindness. This is under community ophthalmology. And middle-aged women who cannot come to hospitals, they have got presbyopia, they cannot see the near vision, like cleaning their utensils. And for them, we give spectacles, very common spectacles we give. And old age people, many got cataract. We update the register called VBR, visually blind register. We train the health staff in the primary center how to identify the cataract patients. We give flip cards and identifying them and bring them to community health centers or taluka hospitals or where the eye camps are functioning, and take them and get the surgery done so that they can see the world again. This is our community ophthalmology. A lot of changes have occurred since the inception of this program. Earlier, we should do only simple surgery, intracapsular, what
Yes.
Dr. Modi used to do.
Yes.
Now it has come
Yes.
to IOL implantation.
And
It's a daycare business
he
now.
made a world record and he became a Padma Shri Modi because hundreds and thousands of people he used to keep on operating. Yes.
Nowadays the concept has changed. A lot of changes have occurred. Now we are doing daycare services. Morning we operate, after discharge. That is being done in government institutions. Lot of modern equipment have come.
Just the eyes to protect them for infection, the dark glasses. That's all. Yes.
IOL surgery has revolutionized the eye community ophthalmology.
Yes.
For that, we should thank the government of Denmark, Canada. Canada program, they helped us in the beginning. They gave us a lot of funds and they trained our eye surgeons for the IOL surgery. They sent to some different hospitals like Madurai Hospital, Shankar Netralaya, Minto Eye Hospital, where the doctors were trained how to do IOL surgery under microscope. It's all done by Canada program was there. Canada government helped for decades. Denmark program. So we should be very thankful for the Denmark government. So many NGOs have there to help us, like Rotarians, Lions Club of India. So they help us in conducting these free eye camps, eye surgeries. Some are screening surgeries, some are surgical surgeries. Totally, it is a community ophthalmology. So the community ophthalmology different. What I appeal is for the medical college, start on community ophthalmology department so that you can serve humanity.
Yes, sir. I perfectly agree because the whole country has got more than 840. And if the 840 medical colleges, they adopt at least 10 to 20 villages or the taluka around them, I think the whole India can be covered by this. I think that's a good idea.
Government gives some aid also. Some monetary benefit is given to the department. We start the eye camps and surgeries. And the postgraduates, they get a lot of exposure also. Medical college gets good name. In OPD,
they get lots of cases to the hands-on workshop.
And they get exposure, practical training is there. It will benefit for the postgraduates, benefit for the medical college administration, and for the community also. This is important to the community ophthalmology. I appeal.
So there is a Swartha and Paramartha. Swartha is they get a name for their own selves and their institutions. Paramartha is the society is served, and the blindness is reduced in the society.
The best example is Arvind Eye Hospital, Madurai, and Shankar Netralaya. What they are doing because of community ophthalmology, they got a lot of fame, and so many postgraduates are there. Lot of exposure.
World famous.
Only because of community ophthalmology. You may not believe, every day they do about 2,000 cataract surgeries in Arvind. Every day, free of cost, 2,000 per day. Can you imagine? I was trained there. I've seen my own eyes. 16 OTs work from morning 4 a.m. to 3 p.m.
Oh my God. I didn't know that. Oh.
2,000 eye surgeries they do per day.
Oh, I think such a hospital should start even in Karnataka. And especially North Karnataka, it's a must. Yes, sir.
So much of community ophthalmology they are working, and they got good name also. So many postgraduates trained. A postgraduate coming from Arvind Hospital is thorough in his knowledge. Surgery exposure, a lot of exposure is got. So I appeal to all the private medical colleges, please start community ophthalmology department so that your institute get good name, the postgraduates get good exposure, and you are doing community service also. The government also gives date. So this is much important branch of community ophthalmology. Doesn't need much qualified any instrument. We don't need one vehicle, simple microscope, and it is the attitude towards the society, community. This is what I appeal to this program, your video. So community ophthalmology, very, very important branch of ophthalmology. That's why I have
Okay. See, everybody thinks of, a very highly technical treatment. And if you take that pyramid of ophthalmology or any health system, the most of the base is for the community. And what you do is at the tip. So the Chinese proverb is there. A mediocre doctor treats when the disease is full-fledged. And a good doctor tries treatment in time. But the best doctor is the one who prevents the disease. So in that direction, the one who treats the community ophthalmology, I think he turns out to be the best person because, they're literally serving the have-nots. they don't even know that this is so important. So ultimately, to finish, what is the message that you would like to give to the ophthalmologist and the people and the Rotarians and the Lions, sir?
I first appeal to all ophthalmologists. It is a government, I am telling you the figures. 770 operations if a ophthalmologist does in a year, we can control this program and we can clear the backlog. You are,
Okay.
I don't, you are, you have got good bad practice, I don't mind. But at least spend one day in a month.
One day
For
in
the,
a,
one day in a
2
month,
weeks or the 1 month. Okay.
one day in a month or Sunday, prepare, collect all your samples. You got to go to one village, adopt, and just you take only torch. I don't need equipment. By torch, you can identify many diseases. And
Yes.
spectacles, you can use some eye drops, some infective ulcers, and vitamin deficiency. You can experience ophthalmology. Did not get all highly equipment. One torch,
Yes.
on your fundoscopy is enough.
Yes.
Fundoscopy, you can identify so many diabetic. You can do diabetic
Yeah,
retinopathy
diabetic
clinic.
retinopathy can be detected. Yes.
I had done recently one eye camp. I saw but only diabetic people. I am not a physician, but I can diagnose diabetes. Then I saw fundoscopy. Many diabetic symptoms I couldn't identify. I didn't do anything. I just sent them to the center. You go, you got retinopathy. You can control. This is diabetic retinopathy also is now coming up very fast in our community.
Yes,
Diabetic
sir.
is
Yes, sir.
almost it is the second cause of blindness in India after
Yes.
cataract.
Yes, sir. Yes.
Glaucoma, retinopathy agri. So this is I appeal to the ophthalmologists and medical college faculties to start this community ophthalmology in medical college, train some doctors, send them to village, a nearby village. You don't go to far off villages, nearby villages. Once in a month or once in a week, just enjoy the village life, eat their food, get out the route and enjoy that and you little your work and collect your all samples so that you are not only you are making money, but you are serving the nation also, serving the community also, and you become popular also. See, popular also comes, and for that you don't need any other extra things. One vehicle and one torch, one fundoscope. That's all what I did.
And the goodwill to
Good
serve
will.
the society. That
To
is the
enjoy
important
the
one.
weather in the villages, pure
Yes.
ಒಳ್ಳೆ ವಾತಾವರಣ, all this you enjoy. See the
Yeah.
India is villages. I appeal to all the doctors to this you are
And it is a stress buster. They can
stress
relax
buster.
also. They
Relax.
can relax
And
and they can
only
come back with the feel good hormones that have done something good.
yes.
And
You can sleep
having done
nicely.
something good, they feel very happy and contented. That's nice.
3 or 4 hours. Recently, I had gone to jail, madam, jail. On Doctors Day, we conducted all the jail inmates. We did refraction. The 950 inmates were there. So many ladies were there. They were not able to see. About 150 spectacles we gave free of cost to some opticals. Lot of
Great,
satisfaction
great.
we have got. Lot of
Great.
I went with all my equipments and saw all the inmates right from morning to evening. With then some optical shop gave us spectacles. And what I am now doing is reusing old spectacles. Some people they come to my clinic. Well, of people I ask what are you going to do. They don't throw, madam. Please give me, donate your frame. I will so that I will give to some poor patients. That same frame, I will get to recycling of old used spectacles, and I take the phone number. I take the phone number, and that to that lady, I will talk to that patient. Sir, your spectacle has reached me. Thank you very much. This also you can do it. One part of community ophthalmology. One part of community ophthalmology. At least 3 or 4 people I do this service in a month. I collect some. I beg actually practically beg from the rich people. The costly free year but don't throw it. Give to me. What are you doing? I'll use for some poor patients. Some poor patients only the frame will give some spectacles and we give them, and through that patient we thank the donor. So they should get doctor has given to a needy patient. It's a part of community ophthalmology. It's a part of community ophthalmology. I am doing for last 15 years. 15 years I am doing it.
I think you are a role model ophthalmologist for all the youngsters to come, and also all those who are doing the community service, they should join hands with the doctors and see that this blindness is reduced and controlled in our country. So thank you very much for your great service. You are a role model, sir. Namaskar.